So because this is going to be part of our lab review, APR worksheet kind of identification all rolled in one, I'm going to just record this as is, and then that way you can kind of go to the sections that you need to when you're wanting to go review for the quiz coming up. So let's start here, axial skeleton, share screen, okay. So you guys should see the title slide. It says axial skeleton lecture. So if you don't see it, let me know. So we're planning on going through all three of these today. The axial skeleton includes pretty much our axis. So in this picture, you can see the highlighted green images. That's our axial skeleton, and that's our job for today. Then the appendicular, which is really our girdles and our limbs. So it's basically our limbs and how they attach onto our axial skeleton. That's really how it's divided. So we have, this is more just terminology. So when we talk about specific bony features, now I'm gonna get out of the share real quick and just show you. So for instance, I don't know, let me grab this mandible. So when we're going to talk about specific features, say on the bone, they are there, they're important because not only are they surface landmarks across our body that you'll need to know the specific name of, but they're also attachment sites for ligaments and bone and muscles. And so they will come up on many, many occasions as you go. So it's really important to have this vocabulary, you know, accessible to you. So I'm going to go back to the share here. So the dents, depressions, openings, bumps, little projections, these are all important sites. So each of these kind of irregularities that we see on the bones will have a name, and that's what we're going to go through. So this is, you don't have to memorize this list specifically. Each of these terms will be in some of the names as we're going along. So for instance, a trochanter or tuberosity is a bumpy part of the surface. So for instance, your legs, let me go back here. Do I have a femur? Actually, I do. Grab another bone. Okay, so here's our humerus bone, but like a trochanter or tuberosity is a rough spot on the surface of a bone. On our femur, where's the femur? Sorry, I didn't have these out, so we're doing appendicular later, but now I'm doing the terminology. So this here is our femur, and so if I'm standing up, it's going to be here. So our hip that you feel out here is actually, this is a giant trochanter. So it's going to come up when we do the different parts of the bones. I'll share screen again. So trochanter, tuberosities, tubercles, these are a bumpy things. A crest is a ridge. So if you put your hands on your hips, that bony part, you're actually resting on a crest. A spine, we're going to have that on the scapula, so it's going to be the back of our shoulder blade. So each of these have a term. A condyle, and again, this is more, when we do condyle at the bottom of the femur, this curved stuff, these curved surfaces are condyles. So if you know what these lists are, so I am not going to ask you what's a condyle, but you're going to need to know that the condyle is going to be named. So when you see the word condyle, you're like, oh, when I'm looking at a bone, it's not going to be a bumpy thing. It's this smooth bottom surface. It just helps you, if you know what they are, it helps you find the features that you're looking for. But them specifically of what's a fissure, that will not be a test question. So of the axial skeleton, we're going to go through the 8 cranial bones. So between the 8 cranial bones and the 14 facial bones, we're not doing all of the bones, but that makes up the skull. And then we have our vertebrae, and then we have ribs. So these are all the things that we're going to go through. So let's start with the skull. This here is your list that's in the lab guide. So when you print it out, or if you did, or you don't have to now, you don't need it now, this is just showing you on the lab guide. I think that the lab guide's way easier to study for once we're done with the lecture. Then this sort of puts it all together, like puts like 20 slide pages together in one thing, so that you would know, hey, for the temporal bone, these are all the features I'm going to have to name from the temporal bone. Oh, for the frontal bone, there's no features, just know it's the frontal bone. So it actually gives you a list of what you're going to either make your Quizlet from or flashcards from. And then if you're going to draw a diagram, and you might like print out, there's really, really great diagrams for the skeletal system that are pointing out way more features. So these here help you narrow it down, saying, oh, these are the features I have to know from the temporal bone, not, you know, the 5 or 6 additional ones that would be on the list. So again, this is a way to show you exactly what you're going to need. So we'll go through this again later at the end, but I just wanted to point that out. So this works in parallel with what we're doing. So so now I'm just going to kind of walk through all of them to explain where everything is, what the features are, and then we'll go back to the list and kind of use that as a way to recap. So the cranial bones are easy now that we've done the brain, because your frontal bone is your forehead. It kind of follows the lobes of the brain. We have our frontal bone up here. We have 2 parietal bones, one on either side, on the kind of the top back of your head. We have a single occipital bone on the way back of your skull. We have 2 temporal bones, which are going to be under each ear. Then inside, we have new guys here, sphenoid and ethmoid. These are new bones, but inside the skull. So we just don't see them from the outside. So we'll get to those as well. So these outside bones are connected via sutures. So you can see the sutures as these sort of wiggly lines that define. So we would have the parietal bone here, and another, here's 1 and 2, the parietal bones are both. Then this here, so this is the back of the head. So this here would be the occipital bone, and this would be our frontal bone. So it's looking at someone's top of their head while they're laying down, looking up at the top of the screen. And so the sutures are really the wiggly lines where the bones are literally connecting together. And they're wiggly because they're connecting together like a jigsaw puzzle piece. So the jigsaw puzzle piece connects them together so they don't shift around. And over time, these sutures actually start to blend together. I didn't bring it with home. I brought several skulls home with me to show you guys, but, and actually maybe I should show them to you right now. So let me go to stop share. Let me grab the top of the skull. So here's a skull. You can see, the pictures are probably better, but we can see some of these. This one's a lot smoother on the inside. You can actually age the skulls based on their sutures. So I don't know if you can see inside this one. This is inside the skull. You can still see the line up and down. And I'll show you this side. And we can see the suture here. This is a sagittal suture. But on this skull, you don't see the line inside yet. It's all kind of blended in. So this one, the blended one is older than the other one. So we're younger, our bones are sort of more separate. They're just starting to grow together, and then they eventually will solidify over time. So going back to the screen share. So the sutures that you need to know are the coronal, which is this one. And I like to think of the coronal, and this is also the coronal right here. Think of the coronal, I think of it like a crown, so that's coronal like a crown, but think of it more like a tiara, or it's really up and down like a headband. You know how, so it's just going from behind your frontal bone, and so it goes up and down on you like a headband or a tiara crown. Then the sagittal suture is located along this line, and you would not see it here. It's just kind of, it's hard to draw on here. It's sort of up there between the 2 sides. So that's where the sagittal suture is. And then the squamous is, I always think of the S for squamous. So you guys already should know sagittal is easy because that's your slice between right and left side. But squamous is this one here. It's actually between your temporal bone and your parietal bone. So I think of the S, I just think, oh, it's curved. It's the only one that's sort of curved like an S here, if you want to think of it, that way. But that's the squamous suture. And then, this is not a very good picture of the lambdoid suture, and I think of it as an L, and it literally goes up and down. It's like a triangle. So I always think it looks like an L fallen over. So let me grab I'm going to stop the share. So here is a skull. So here's the top of the skull looking at you. Now here's the side, and it has the little connections where it was going to connect the space here. So we would have, I don't really see the squamous one on this guy as clearly, it's actually too high. But on the back, so ignore the sticker on this guy, but you can see this here is the occipital bone. We have our sagittal suture between the two parietal bones. This being with the sticker on it is the occipital bone, but see how it's really angular? It looks like a roof line. That's the lambdoidal suture. Go back to the share. So lambdoid suture, and I think of it as an L. If the L fell over, it would just look like that roof line. And then occipital mastoid is, I would be less likely to ask you about that, but I'll still point it out. So the lambdoid comes down here. That's this one. And then occipital, because it's still between the occipital bone and then the mastoid process, which we haven't learned yet, which is actually this bump. It's part of the temporal bone. So it's actually a little line here. Let me get rid of that bone. So that's the occipital mastoid suture. It's just the part of the occipital bone that lines up behind there. So the infant skull, oh, I should have brought those home. Okay. I have a real infant skull, but I wouldn't have brought that home. I have some plastic infant skulls that are models that I should have brought home. But you can see this is the soft spot. You can see where the bones, here's a frontal bone, and we talked about in bone physiology how these flat bones grow between two membranes. And so they start with these growth centers that radiate out and radiate out. So they're still pretty curved by the time the child is born. And so postnatally, then it has to fill in, you know, all this extra place. It needs to grow outwards, just like this side is going to need to grow outwards. And this side is going to grow together. And so while the child is in the first year of life, it's still growing. But the reason why evolutionarily, the theory with that is we evolved, again with the theory, so I don't want to make anybody mad, especially during Easter week. As our evolution progressed, we have our advantage as a Homo sapien is that our children's brains can continue to grow. It is not stuck in a solid skull at the time they're born, thus limiting the growth potential. So while these bones are filling in, we're also still expanding. But if you also look at children, like toddlers and preschoolers, proportionally compared to adults, they have giant heads compared to their bodies. It's also actually, if you take a psychology class, one of the reasons why giant heads and giant eyes actually trigger certain parts of our brain that lends us to have a more protective nature. So there's sort of the reason why teddy bears and toys are built that way, or, you know, and why people generally have a protective nature towards kids. But proportionally, they're born with bigger brains. There's some brain growth, but the ability or the inability of these bones to be fused together at the time of birth not only helps the baby to get out of, you know, the birth canal, because they have bigger brains, so the head is more malleable and can get out more easily, but then it allows for more growth during that first year of life. So those are the soft spots, and literally in these parts right here, it literally is just a membrane. You could just stick your finger down and, you know, and you're poking down, bending the membrane down, and you could be like, there's somebody's brain. So they very much are not protected during this time, and they have to be, you know, take care. So you have some soft spots here on the side. You have, you know, they're actually all along. Most moms can really feel the one at the top and the ones at the side. And when you take your kid in for, you know, your checkups, the doctors are always checking on these soft spots, and they're feeling them too, because they want to sense the pressure inside. Oh, I didn't show you. My son had brain surgery when he was little because he had an obstruction. Now I can tell you guys know about this stuff. His choroid plexus ruptured in one of his lateral ventricles. So we had all this blood in his cerebral spinal fluid, which made him have a fever. So then it resolved, but we get to Phoenix Children's Hospital because I thought he had meningitis, he had a fever, and he had a bloody spinal tap. But then it turned out had he not, so this is where it relates to this, we ended up having brain surgery. It was a blood clot that stayed in there because the next time we did a follow-up MRI, one of his lateral ventricles was huge, and because it was still making fluid, but the fluid wasn't going anywhere, so it was obstructed. But as a child, their heads, because the bones aren't fused together, can continue to expand. So he could have been asymptomatic for a long time, and we would have gone a couple months and the doctor would have said, oh, he's got kind of a big head, and then a couple months later, his head's getting bigger, and then he would have had to have a shunt. So thankfully the fever alerted us to the problem. They took the blood clot out, but you could really, so the head can really expand a lot, even if there's a pathology going on inside the brain. So anyway, that's our infant skull. This is just a list showing you what those soft spots are. The true name for them are fontanelles. And so they're just connective tissue over these areas that the bone has yet to fill in. And it's allowing the skull to flex during birth. So if they look like anything like my niece when she was born, she looked like a cone head, when she came out. And so your heads can kind of get flexed that way. This is the list of the fontanelles. The important ones are really the anterior one, which is your top center. And then you have the other one, the occipital fontanelle, that's towards the back, squamous and coronal sutures. This one's the side one. Those are the two most important ones I think people can palpate and would be more ideal. You'd want to identify those ones. So this is an actual fetal skull. And we can see those there. Okay, so now on to just an adult skull. The first bone we're going to do is the frontal bone. And pretty much that's it. Your forehead, frontal bone. There's no features. Here's some features that are listed, but they're not on your list to know. So you would have your frontal bone, includes your eyebrows, the top part of your eyebrow. It's actually intended to protect your eye. So that's why there's a bit of a ridge and a shelf there. And then this frontal squama is just the broad expanse of your forehead. So it's more just so if you hear those terms. If I have a skull picture and I'm pointing it at you, pointing at this part, I just want you to say frontal bone. There's nothing else beyond that. We have the parietal bone, same there. This is a parietal bone here. So the parietal bone is this area, and there's going to be two of them. So if there is a skull picture with an arrow pointing to it, you will just need to say parietal bone, but you're going to have to say right or left. Now, this is where a lot of people lose points, and this is where I am really picky about. So if you're going to see a picture, you will always need to indicate right or left if that's the case. And when we do features, you're going to have to do those correctly. Right now, we just had frontal bone as a standalone bone and the parietal bone as its own bone. Frontal is easy because there's no right or left. It's just as frontal bone. Parietal will be right parietal bone or left parietal bone. This is where we start to get a little bit difficult. Now, the temporal bone is right here. I'm going to outline it. Okay, hold on. I see there's a question. More chat. Hold on. Okay, hold on. I gotta stop share. Whoops. It's always going to be right or left based on the picture, like if that's the patient, not your right or left. So in this case, we'll go through that. So the temporal bone is outlined in this particular picture. I want you to, the way the top part here of the slide is the format that you need to write this in. You will, when we have a feature, and I'll go through the features just in a moment of like what each part is. When I go through these features, you will, because we know we have, here you go, baby, 2 temporal bones, 1 on each side of our head. In this case, because it's this guy, not our head, it's this guy's head. In this case, it will be his left temporal bone. So we can do, but in this case, because there's 2 temporal bones, we'll go through the labeling. So the temporal bone, so let's first go through the features and then I'll finish how you write it at the top. The just to get ahead of us, the zygomatic bone is the bone that is the apples of our cheek. So our cheekbone, that's zygomatic. So we're talking about the temporal bone, but the zygomatic process, the feature that's called process means sticking out piece. So this is a process, and this is a process, and this is a process. So those three things that I sort of wrote and sort of colored out dark, they're pieces that stick out, these protruding projections, if you will. So of these three, we're naming all three that's in the red. So the zygomatic process is this first one. It's actually part of the temporal bone, but it's sticking out towards the zygomatic bone. So it's not the zygomatic bone, it's just the zygomatic process. So it's telling you, hey, there's a sticking out piece pointed in this direction of this bone. The other one, so maybe we'll put like a number 1 here. Maybe it'll help. Number 1, the mastoid process. We can all feel our own mastoid process. I'll just draw it here. That's number 2. So that's this sort of projection down here. So I'm going to stop share for a moment. So our mastoid process, if we go to our ears and right behind where our ear is, so here's our ear, got my earring on, right behind it is our mastoid process. We can feel that on both sides of our body. It's just a bony, rounded projection. It's not real pointy. We'll go back to the screen share. Go. So number 2 is our mastoid process, and then styloid process. We actually have 3 styloid processes that you're going to need to know. This one was just styloid process of this particular bone. Whoops, I just hit the table. The styloid process is this really slender, pointy thing that's coming down here. And actually, the skulls that we have, it's incredibly rare to have one because they get broken off in class all the time. So I'm going to stop sharing. So maybe you can see it because this particular one has it. Let me see if I can show it. Let me touch it so I don't want to break it. So the tip of my finger is at this styloid process. It's super tiny, and the word stylus means pen. So it's like a real pointy, like the end of a pen. Let me go back to the share screen. So that's the styloid process. And then the last thing, and then I'll do the naming part, is the external auditory canal, also known as the acoustic canal. So we just did hearing, and so that's it right there. The hole that would be where the hearing goes. And actually, I should go back to the stop share. So in fact, on the skull, you can just see the hole. This is where we hear through, right there. So that's our external acoustic canal, auditory canal. There's lots of different names for it. And actually, when we're dissecting on our cadaver, and we have the skin, like say on the cadaver, all you have to do is take your scalpel and literally cut, and you peel the ear off with the skin, and you just cut right through, and then you end up with this hole right there on the other side. So when we do the cadavers, you just like this Hannibal Hector the face and peel the skin off, and the ear just comes right with it. Sorry, that's probably too much gross information. Okay, so how we name it. This part is important. So let's start with zygomatic process. If I'm have this on the test and I say, hey, I need you to name this item with the X on it, you would write as your answer, you would write zygomatic process, that would go here, the feature's name, of the, and this is of the temporal bone, and because this is the left, of the left temporal bone. So you always write the feature of the bone. The trick is sometimes you have one bone. For instance, later we're going to do a mandible. We have one bone. And see that little hole? There's one on the other side. So sometimes there's 2 features and 1 bone. And in that case, the right and left will be in front of the feature. Anyways, we'll get to that. But in this particular case, we know there are 2 temporal bones. So in order to distinguish, we have to determine, is this going to be the right or is it going to be the left? And in this particular picture, on this particular skull, it is this guy's left. Doesn't matter which side of you, it matters what side he's on or she. And then the feature, if I'm going to point out this, or let's just do a different one. If I point out this one and say, name this feature with the X on it, you would then say, oh, this here is the mastoid process of the left temporal bone. And that's how your answer would be. So it's always feature of the bone, and then you throw in right or left in the correct location. So of here, the reason, and the other thing I wanted to show you, of here, you need to know these 4. The others are listed sometimes. I don't think I put this one on your lab thing, but the other 2 are listed on your lab part, mandibular fossa and carotid canal. I still thought they were important, so I wanted them on your list, mainly because this mandibular fossa is part of your TMJ joint. It's right there. But I'm also trying to minimize the stuff that you have to know. So I still wanted to tell you that because I feel like you should know it, but I'm not going to test you on it. So that's why that's sort of not numbered in this particular slide. So that's my system. Okay. Oh, I have number 2 and 3. Okay, so we'll move along. The occipital bone, that is the back of our head, and there are 3 things that you'll need to know from it. So in this case, this is an upside down skull. So this is the occipital bone is going to be the thing in brown. There we go. So that whole brown area is the back of the skull, back and underside. So let me, I'm going to stop sharing. Okay. So I'll tell you, and then I'll go to my skull that I have in hand to show you. So we have an external occipital protuberance. That's a super fancy name. If you were to feel the back of your head, sort of run your hands down the back of your head, there's a pointy structure. So you feel it sort of like this part right there. So as you're running your head, and if you, I don't know, I remember watching basketball, and a lot of those guys have their head shaved. So if you see people with their head shaved, some people have super pointy external occipital protuberance. It means on the outside, it's on the occipital bone, and protuberance means it just juts out there. So some people can have a pretty mellow one. Some people have a super prominent one. So you can see, actually it's where a whole bunch of ligaments hang on to help lift your neck, and it connects to muscles on your back. Then we have right or left, that's what the R now, occipital condyles. So if you remember, I'm going to stop sharing. Oh, I just did something weird. Okay. So on this skull that I have here, if I turn it around and our occipital bone is in the back, and then I tip it up, we will have the, oh, actually you can see external occipital protuberance right there. It's kind of a bumpy part. But then if we go under, look at this giant hole. That's where our spinal cord is going to go through. So the feature that's known as a foramen just means a hole. Well, that's a pretty big hole. So that's why it's called foramen magnum, for magnum being massively giant. So this is a foramen magnum right through here. That's where spinal cord is going to go. So this would be the foramen magnum of the occipital bone. Then notice these 2 parts right here that I'm pointing to, and there's these flat surfaces, and these are known as our occipital, because it's our occipital bone, condyles. So condyles are these smooth surfaces. We have condyles at the bottom of our femur, you know, smooth surface like this. So this is a giant condyle. So this is where we're going to deal with this when we do the femur. So again, condyle just means this smooth surface. And in fact, when we start our vertebral column, these condyles here will sit on top of our first vertebrae. And you can imagine it's what we rotate our head to say yes. So our skull is saying yes. So they are rotating up and down. So that's what these 2 things are, occipital condyles. Let me go back to the share screen so you can see the actual picture of it. Share. And we'll go here. Okay. So we have our, here's their numbered. So number 1 is external occipital protuberance. That's the pointy part. We have our, in this particular case, this would be our right occipital condyle, and this one over here is our left occipital condyle. And then the middle, there's just one of them. So it's just the foramen magnum of the occipital bone. So each one of these, you'd always have to end the sentence. You always think of the bone name as somebody's last name. So you always want to end it with the last name. There we go. So the ethmoid bone. So now we're going to get into the two bones that's on the inside that we haven't seen before. And so the ethmoid bone, I think we'll just tell you about. So the ethmoid is up here. It literally is the top of the nose between the eyes. So I'm going to go screen stop share. So here's our skull. We're looking at his eyes, we see his nose. Now if I tip the skull down, the part in here that someone colored in red, that's part of that top part of the ethmoid bone. And then there is, so the ethmoid bone is like this upper, really central part, and literally it dives down into your nasal cavity. And so it forms the top of your nasal concha. And I don't think we didn't, yeah, we did nasal concha. No. Did we do nasal? I know we did nasal concha in 202 because we talk about turbulence, but I can't remember if we did it for, no, I didn't do it for senses for you guys. Okay, so I'm going back to the screen so you can see it. So this picture here really just shows it like, hey, you have an eyeball here and an eyeball there. Sort of bad perspective. Maybe have another picture. No. So this here is your divider down into your nasal cavity. So your nostril, you have one side on this side and one side on that side. And we actually have these funky bony structures. Ooh. See this one? No. Most of our skulls, they're broken. I have a javelina skull, if you guys have been to my office outside by the women's bathroom. And the reason why I have that javelina skull is I take it for this very part. My dog found it and brought it home. I was just all dried and found it, but it has really fantastic nasal concha. So if you were to look up a skull up their nose, there are these really wafer thin curved bony structures, and it actually is meant to make our air have turbulence, and for a bunch of reasons we'll learn about in the respiratory system. So what you need to know is the cribriform plate, and know that the concha, that's these little curly things, are located in there. We actually have 3, but the top 2 are part of the ethmoid bone. The most important features I would probably ask you about on a test are these 2. I would probably, and just know the concha are also in there, but I probably would not show them to you on a diagram because they're too, this is such a funky diagram. I hate it. I just want you to see it, how it goes. Really, the top part is just this part because most of it's going down in the back of the nasal cavity. So it's more for perspective. But of these 2, notice in this picture, see how there's holes there? I always think it looks like, I mean, it's kind of an old-fashioned game, but I still like it. A cribbage board, do you remember cribbage? It's like a little piece of wood with holes in it that you put little pegs in. I always think the cribriform plate looks like a cribbage board. So that's how I remember it. So you have a cribriform plate on this side and you have a cribriform plate on the other side. Who can tell me what the purpose of this plate is above the nasal cavity with holes in it? It relates to what we just did in Unit 3.
Where the smell comes from, where the mucus comes down?
Got it. Yeah, so the olfactory nerve. So remember those olfactory bulbs at the bottom of the brain? So the bulbs literally lay there. So I'm going to make it solid. Like this would be an olfactory bulb. And then you remember the olfactory tracts are going to come back into the brain. But from the side view, the olfactory bulbs are laying. And so when we did the senses and it showed like these little nerve endings dangling down into the nasal cavity, they're going through the cribriform plate so that the little nerves for the smell all can just dangle in there. I always think of like, I always think of our smell receptors as being like chandeliers. Like if you go to a lighting store, there's lights hanging everywhere. And so all the lights themselves would be the different smell receptors. But the wires that they go up to above the roof and all the electrical wiring, that's going to be your olfactory bulb and tract laying on this side going into the brain. But when they're coming down out of the ceiling, they're going through the cribriform plate. Ryan, did you say something? Sorry.
Oh, I was mentioning that I used to be an electrician, so I know like about the pendant lighting
There you
and
go.
whatnot.
So yeah, there's a point where it's the hole coming down from the ceiling. But this is kind of a crazy thing. If you, say it happens to jockeys sometimes, if you get in an accident, because we have a cerebral spinal fluid that's really, our brain is so filled with fat or made of fat that it floats. The cerebral spinal fluid literally has our brain floating. So if you get in a traumatic accident, say you're a jockey and the horse goes down and you fall off, that person's brain will slosh back and forth, literally in the skull, and obviously cause bruising of the brain. But what it can do sometimes is the little nerves dangling down through the cribriform plate, they can get sheared off and they don't grow back. And you could lose a sense of smell that way by a traumatic injury, just the brain shooting forward and back and just these delicate nerves going down through there. So that's a little side. So back to on point here, the cribriform plate, we actually have two of them. So there's going to be one on the right and one on the left. And so in this case, this would be the right, and this one's going to be the left cribriform plate. And then you cannot see it so much from this picture, but there is a crista galli, and it's aligned. It literally is, let's see if I can, no, I'm going to try to show it to you in the skull. It looks like a shark fin. It sticks straight up and down. And so in here, so I've got, you have the red cribriform plate. So if I move this to the side, I don't know if you can see, let me point it, so it's black, but it sticks up like a shark fin. I don't know. So I don't know. So this is a really not nice thing. And I don't mean to be mean. As a student, I always try to think of things to make me remember. And so I knew this girl that I thought was mean, and her name was Krista. So I was like, she's mean like a shark. And so that would help me to remember shark fin is Krista. So again, I don't know, come up with some other association, but cribriform plate, cribbage board, those kind of things. So if we have this picture and I'm like, hey, what are the holes in the skull that olfactory nerves go through? You would say, and that's a type of question that I would ask on the lecture part, like where I'm just asking test questions of, you're not visually seeing it from a picture, but I'm asking you to describe it. Hey, what are the holes that olfactory nerves go through? And then you'd be like, oh, cribriform plate, the ethmoid bone. Or what is the dividing, and I sometimes actually will say shark fin, between two olfactory bulbs. And then you would say, oh, that's the crista galli. Or even galley, it looks like a sail. That's another thing. If you want to think of it as a ship with a big sail, they had those big, what are they, galleons, whatever. I'm not a very good nautical historian. So that's that. The sphenoid bone is actually this weird bat-like structure inside. The only two things that you need to know are that little circle. So these are counted as one. And then those circles are known as the optic foramen. Some books call them an optic canal. So this is written really weird on this slide. So this here would be, let's say, if I'm pointing to this one, this would be the left optic foramen, because foramen of the sphenoid bone. Now the optic foramen, if you guys remember from the brain, that's where from your eyeballs, those optic nerves came back. So here's the other eyeball. And so right above it is where the optic chiasma would be, where the X is. So this is actually the hole where the nerves from the eyeball are coming out. And then interesting enough, in this part you really should be in person, but let me grab my screen share. This other part that's known as the sella turcica. So if we have this in here, here's my skull. So the sphenoid bone wings out to like this yellow and pink part, but I actually don't care about that part. So I only care for you guys to know the part of the sphenoid bone that's here in the middle. So we have our two optic foramen. So I think you can kind of see the holes where from the eyeball. So from the eyeball here, if we were to like see poke through, which I don't want to because I'll break the glove, but if you poke through the back of the eye, it will come out the two holes here. So those are optic foramen. They make an X. Now in here, the way this sits, and again, you're not gonna have perspective, but the brown part that's just below it, it literally sits below. So you have, okay, this is a super weird analogy. It's where these two holes come out, there's a dip that goes below it, and that dip cups the pituitary gland. So I was in class, if you guys had the skull with you, but you're gonna have to get really creative with your imagination now. If you picture a tiny Barbie doll, okay, tiny little Barbie doll, and her butt is sitting in this sella turcica. The word sella turcica means Turkish saddle. So it actually goes down like a saddle. So picture perspective-wise, because you can't really see it well in this camera, if you have this miniature Barbie doll, her butt is in the sella turcica, that's where the pituitary gland would be her butt. And if she were to like stick her arms straight out, like maybe she's riding a chopper or some sort of motorcycle, her arms would go right through those optic foramen. So that's the level of where they are. So in our body, where the arms are going through, that's the optic foramen, that's the nerves from your eyes, and then they're gonna make a crisscross, but the pituitary gland would be down below in that saddle. So this actually comes up, I will ask usually people in my 202 class, when we start talking about the pituitary gland, then I say, hey, what bony structure does it sit in? You should have learned this in 201. So anyways, this is where you should learn it. Okay, so back to the stream. So you should just know the optic foramen, those are the two holes, and then the sella turcica is just the dip part here and actually goes down because it's a saddle. Okay. So in the lab guide, this is lab guide list. So this is a new slide on here, but if you've printed out the lab guides, this is what we've, this is what we're about to do. So then I have, let me go back. So I'm going to zip all the way back to this list here. So this is what we've done so far. You should know the sutures. So here's the different sutures. So then you could label it on these. A lot of my lab guides, I don't label things on purpose because I want you to do the labeling. Then it has listed here the frontal bone. It just tells you in italics what it is so you can find it, but there's no features. So everything that's here that's kind of has that main bullet point, that's the bone name. And then this subgroup here is the feature. So we can see there's no feature of the frontal or parietal bone. You just have to name it, or in parietal in case it's two, it'd be right or left. But we can see temporal bone. We won't do these guys. You would have to know these guys here. Oh, I'm missing one. Mastoid process. I definitely want you to know that one because that one I usually is the one I usually ask you on the test. See, you guys help me edit here when I have to look at these that closely. Add mastoid process to your temporal bone, and you can put an X through mandibular fossa and carotid canal because I won't ask you about those. Okay. Occipital bone, you should know the foramen magnum. Remember, that's this giant hole at the bottom where your spinal cord goes out. Your occipital condyles, you don't really see it here. It might be way under there. That's what you're gonna like rotate, sits on top of the spinal column that you're gonna say yes with. And then your external occipital protuberance is kind of a bony piece that sticks out in the back of your head. The ethmoid bone is inside. You should just know the cristagalli cribriform plate. I probably would use the concha more as a word question. You know, the concha are part of the what bone or something. The sphenoid bone is here in the middle. You've got the two holes that are optic foramina is just the plural form of that. And sella turcica is the little dip down here. So this is kind of, so this is what you would want to use to make your list, that you would then say, it doesn't spell it in the right way. So if I was going to point out styloid process, if I were to say name this, you would write it correctly. You would say styloid process, and I abbreviate, of the temporal bone. But more than that, we'd have to do, in this case, left temporal bone. So again, that's the proper way of putting it. Okay, so I'm going to go up here past all these to the next one. Oh, I went too fast. In our next part, we're going to do the bones of the face. Okay, so and we'll come back to this. I just forgot to copy it and put it at the end of this here. So the mandible is our jawbone. That's the one where like open, close, lift, and elevate and depress is the actual terms for our mouth opening and closing. So on here, do I have it? Yeah, and this is, okay. I wasn't sure if I had numbered. So of the mandible, we don't have to do right or left because there's only one of them. So that makes life easier on that part at least. So the ramus is this part that's right up here. This is the ramus. And then the mandibular condyle, remember a condyle is a rounded piece. The condyle is actually this rounded part of your TMJ joint. So it's going to do rounded here. Your condyle. The angle is going to be here. And so if you're touching someone's face and the back corner of their jaw, sort of below, so in case my earring's hanging down and just right in front of my earring and the part of my jaw, if I'm pointing to it, it's sort of the angle, that's the angle of the mandible. So in this case, it would be, I'm personally touching my left angle of the mandible because there's two sides, you have two sides of it. So in this case, it would be the left angle of the mandible. That's how you would name it. Okay. Then the body, so I'm going to go mandibular frame. I'm going to stop sharing so I can show you on here. So here's a mandible. Here it is. So we have, it's easier if I use my mouse, which is right here. Okay, sorry, all the videos are in my way so I can see. So of this mandible, the ramus is this part that's sticking up, like up to the back side. And then the mandibular condyle, see how these rounded things. So there's two of them. I'm just choosing to not have you name this front one for now, or actually just not, I took it off your list. So the mandibular condyles are this posterior one, and it's actually your temporal, people know their TMJ joint, so when you open your mouth, and it's moving, that's this guy here, your mandibular condyle moving, that's your TMJ. The angle is this corner, this pointy part here. And then we got to a mandibular notch. That's this U part, right, located here. That's the mandibular notch. Then the body, that's just all this front part. So if you were like, you know, one of those old grandmas that grab somebody by their chin and be like, pay attention, whatever. You're grabbing the body of the mandible. That's that part. That's this part here. This is the whole kind of beamed part. And then this part reminds me of the sculptor Rodin. So this is where I'm going to throw in a little culture there to you. But the mental foramen. So you guys remember the word foramen means a hole. And so mental, this is where you think, okay, mental is your brain. No, think of the Rodin sculpture, the thinker, and he's sitting there with his hands like sort of in this contemplative pose. So that's how I remember the foramen of this little chin. Oh, this one's got a bad one. Well, it's just small. This one's pretty small too. Okay, I'm gonna grab this guy. You can see there's a hole. That's a mental foramen. And on this side, there's this other mental foramen. So there are two mental foramens. There's holes in the mandible. The hole is actually where blood vessels and nerves come out. And so they're coming out to serve the face and muscles in that area. So the mental foramen. So I always remember, I think mental as a student, that's kind of crazy to call it mental, but that's where if I think of the Rodin sculpture, he's thinking and his hands are on his chin. So that'll maybe clue that into you a little bit more. So then from mental foramen, then what else do we have here? Alveolar margin. So alveolar, all that is are the holes where your teeth go. Sorry, I hit something. So these guys, it's unfortunate. So these are the real skulls. So I keep them hidden in the lab. So we use the plastic ones. So I only take them out for my class. And nobody else uses them, thankfully, because the teeth are missing and they've been so badly, damaged. But the good news is we can see the alveolar margin. So the sockets really where the teeth used to be in, that's the alveolar margin. So alveolus sort of refers to a space, just means a space where the teeth would go. Okay, I'm going back to the share. Okay, up here, mandible slideshow. Okay, and mandibular foramen, I think I'll tell you about it, but I think I took that off. I was looking through some test questions, so I probably won't point it out to you, but I want you to know. So do I have a picture? Yeah. Here on the inside of your mandible is your mandibular foramen, and I'm only going to tell you about it. I know it's bad teaching protocol to say, oh, I'm not going to ask you a test question, but I'm telling you about it anyways, because that just tells you to turn your brain off. But if you want your dentist to know about it, or if you're going to work in the dental field, because in this mandible, if the person were like here, like me, and they open their mouth, and they make their mouth open, I want you to look in the inside of the ramus. See, there is a little hole. See that hole? Not the dark screw that had actually tethered it to the skull, but there's a hole here, and it's actually where the nerves come out that go to the teeth. So if you're going to get your teeth drilled on or get a filling put in, you want your dentist to be able to aim for the area near this mandibular foramen to put in the Novocaine so that you won't feel anything. And it actually varies. My brother-in-law is a dentist, and so one time I brought all these skulls home because I knew he did a way more head and neck anatomy than I did. So I had this row of skulls, and he was going through them, but and we could see from the skulls how much this mental foramen was higher, lower. It varied from person to person. He said, as a dentist, it's really hard because the fleshy part of people inside of their mouth vary too. So you have to really palpate and kind of use your best sort of expertise to know where to actually administer that Novocaine. So anyways, but because it's so hard to point out and to see on a test, I don't usually use that. Alveolar margin, I probably won't. I'll just say, where do teeth belong? And so anything with alveolar would refer to teeth. So these are the ones that would be the ones that you would more want to focus on if you're looking at a picture that you're going to have to point and identify. The maxilla is your upper jaw where your top teeth are coming from. So we also have an alveolar margin right here. And so just know the alveolar margins where the teeth go. And then for the upper jaw, we have palatine processes. So it's plural, but as an adult, it forms one. A process is a sticking out piece. So it really is this part here, the front part of the roof of the mouth. We'll put number 2 here, are the palatine processes, which means a sticking out piece of your palate. Now, next I'm going to show you, I'm just going to get ahead of myself here. This portion here is a totally separate bone known as the Palatine Bone. So you can see where number 2, the palatine process, is actually a part of the maxilla pointing to this palatine bone. So it forms, so you actually have 2 bones that form the roof of the mouth. One is the maxilla and the other is the palatine bone, which we'll get to. So on this skull, maybe this one's better. Okay, so here's this skull. The palatine, or sort of the maxilla, we talked about as being the roof of your mouth. So if you were to put your thumb in on the roof of your mouth, you're touching the palatine process of the maxilla. But your mustache area, that's also part of your maxilla. And in fact, your maxilla comes all the way up to the front part in front of your cheekbone, and it even goes all the way up towards your eye. So the maxilla is this whole front part, is really kind of this whole front area, as well as the front part of the roof of the mouth. Okay. So one is the alveolar margin. Don't worry about the processes. Those are the parts that are sticking up. And then the palatine processes, in this case it's 2, but as we age, it will fuse together. People with a cleft palate, this is the part that it doesn't ever fuse together. It stays gapped open, and then it continues on to the front. And that's why you see it as the hair lip in the front, but it actually continues into their mouth as well. Okay, so that dotted line just tells you where the maxilla ends. So the palatine bone itself is just this back part. So it's a whole separate bone. It's just a flat part in the back. And it's just named a palatine bone because embryologically it started from a different bone source. The nasal bone, well, that's right here. If you were to if you're wearing glasses and you shove them as far up your nose as you can, well, not up in your nose, but on top of your nose, it's going to be sitting on the nasal bone. Further down your nose, this part is all cartilage, so it goes away in the skull. So nasal bone, super easy. Vomer, that's just this. The vomer divides your right side and left side. This here is just a really fancy name showing you the parts of it. So actually that ethmoid bone, remember, came straight down. That's the blue part, but you don't have to worry about it. So the vomer is really just the divider between the right and left sides of the nostril. Lacrimal, remember lacrimal gland? That's what made tears. Well, when the tears went across your eyes and they drained down, I said when you cry, it's going to come out your nose. That is because it goes to the lacrimal fossa, which is a hole in your lacrimal gland or your lacrimal bone. So the hole is a feature in the bone. Okay. The zygomatic bone is your cheekbone, is the apple part of your cheeks. There's just one feature. Remember, we talked about the temporal bone with the zygomatic process. Well, this part sticking back towards the temporal bone is the temporal process of the, in this case, left zygomatic bone in this guy, in this particular picture. So I'm going to stop share. So the cheekbone that somebody has, see this arch? So we have the apple of the cheek, so it's like the front part here, that's zygomatic bone. So then your cheekbone arching back, which we see here, this sort of range here, it is made up of two bones. You have the front part is made up of the zygomatic bone and the back part is made of the temporal bone. It's coming from this whole part here. So this back part is actually the zygomatic process of the temporal bone, where this front portion here is the temporal process of the zygomatic bone. So it's like they have their opposite names. Okay, back to the share. I'm gonna be getting about done with the face by now. Okay, hyoid bone is the only free-floating bone of the body. In fact, do I have it on my little skeleton over there? No, oh, I do, but it's too little. I probably won't, you'll see it on a skeleton. It's not connected to anything else. It's directly under the neck. You can see it right there. So it's sort of suspended out in place. It has muscles connected to it with that are in charge of breathing, as well as your tongue, not breathing, vocalization. It also is where it's located. If you were to palpate it, you really have to know what you're doing and you can kind of hurt someone, so you have to be careful, is literally the location of the hyoid bone is if you take your forefinger and your thumb and you just put it at the base of your jaw and you were to sort of palpate within there, that's the location of where the hyoid bone would indeed be. So all you need to know, only free-floating bone in the body, and if you see the sort of hovering bone in there, it's just hyoid bone. We don't really use it too much. Okay, so this is part of our review for our worksheets. So the APR worksheet that you have listed on the online people have the website or the software to actually go in and click on each of these features and it highlights it. So you guys don't, so this is why we're doing it here. So this is a way for us, so we'll go frontal bone. So we'll identify it on here. So this will be the frontal bone. So you can color this here, you can do it in different colors. So I'll erase it each way so we don't get too messy. For the maxilla, we've got this whole area here. That's our maxilla. Our mandible is just going to be our jawbone. It's our mandible. The zygomatic bone is going to be this. Here's our apple, sort of apple of our cheeks. That's our zygomatic bone. For the nasal bone, you can just see it sort of, there's two of them, one on each side, because there's a little divider between the two. So it's obviously the top of the nose, it's the bony structure. The rest of our bone, our nose, is actually cartilage. The lacrimal bone, can kind of barely see it in here. It's just going to be on the medial corner of our eye socket. Okay, I think my son is playing hockey in the hallway outside here. I can hear the puck banging against the wall. So if you hear banging noises, that's what's going on. Okay, cervical vertebrae. We haven't gotten to that part yet, but they're the vertebrae that's going to be here in the neck, just so we can identify it. The vomer, that's this line here between the two nasal sides. So the sort of like it's part of your nasal septum. It's just the bony portion. And then our inferior nasal concha, we can actually, the ethmoid bone, remember, inside is part of our superior nasal concha as well as our middle. The inferior, actually their own bone, and that's these guys right here. And this particular skeleton has them a little bit broken too, because normally they come in and they literally, oops, arch around. Oh, I should have brought this. No, I should not have brought this. I had these, a face or somebody's head sliced like bread loaf slices. And then if we take it off in the right part, you can see the nasal cavity with the concha quite beautifully. But I think even I would even draw the line at bringing that home. So, okay, I was thinking that's when I normally pull it out, but yeah, you're not going to get to see it this time. This is a great view of the hyoid bone. Let's see. So we did frontal bone, put the frontal bone here. Maxilla, it's going to be your upper jaw here. The mandible here. The zygomatic bone, I'll put a Z here. The nasal bone, I'll put an N there. And the lacrimal is going to be just on the inside of the socket there. So that's as far as kind of just to show you the other perspective of the ones we just did. And then we'll continue on this list. Our right temporal process of the zygomatic bones, I'm going to color this in blue. So if we have our zygomatic bone, I'm going to outline it. Oh, before I do that, I'm going to show you. See, there's like a little crack. I don't know if you can really see it very well on your screen, but there's a little line, and that actually this line is the end of the zygomatic bone and the start of our temporal bone over here. So I'm going to outline the zygomatic bone. And then I'm going to color in dark and blue the temporal process of, in this case, this is the right temporal process because it's the right side of the zygomatic bone. Then I'm going to change colors to red. So if this is our temporal bone, so that's our, well, I don't have it listed there, temporal bone. And in particular, the zygomatic process of the temporal bone is this part. So it's the back side of your cheekbone, if you're the arch of your cheekbone. So it's your cheekbone arch as it goes, extends back towards your ear is actually made of two bones, these two. Then we have our mastoid process. I'll circle the M here because this is our mastoid. I'll put a big M here. That's our mastoid process of the right temporal bone. We'll do green. Our squamous suture, I'll make it wiggly because this is the wiggly squamous suture there. Let me do this in purple. Our coronal suture, it's like a tiara, kind of right up there. That's our coronal suture. And then our external auditory canal of the right temporal bone. Just gonna do a circle because that's what this is right here. You can see that where we're going to hear into. So that's part of your worksheet. Let's see what the next page. So this is the same list. It's just showing on one page several different views. So we can still see our frontal bone. We can see our maxilla. We can see our lacrimal bone. I'll put an L here. We have a nasal bone that's there. Z, this is our zygomatic bone. You can kind of see back here, temporal bone, and then this is our zygomatic process sticking up there, but it's just not a very good view. But that's kind of just a zoomed in view to see that eye orbit. So this is from your lab guide. So, and I have this in the wrong place. So I meant to have this at the end of the skull part. Hopefully I have the other one. Okay, so this is from your lab guide for the face. We have of the mandible, which is down here, this is what you need to know. So I probably would not ask you the mandibular foramen or the alveolar margin, except you should know alveolar margins on either the mandible is just where teeth go, but it's not like I'm necessarily going to point to it. I'm more likely to point to one of these others. Let's see, the maxilla, palatine process. Palatine is just its own bone, nasal bone. So if I'm pointing here, the answer is just right nasal bone. But if I'm pointing to this circle down here, then the answer would be a lot more complex. It would be the right mental foramen of the mandible. You know, so if it's a feature, that's where you want. If it's just a plain bone like these guys, easy, nasal bone, vomer. If you've got this going on, it has another layer of complexity. But again, it's the same pattern, so just follow, you know, the pattern. Okay, I'm going to go stop share. So let's see, where are we at? Okay, we've been going out of this pretty hard. We have next is the vertebrae and the ribs. So there's not, I mean, we'll go through them. It's not as long. It's shorter than where we've been. So I'm going to just power through so we can kind of maintain this recording, and then we can end with that. So let me grab a few things. I didn't get my tall vertebral column. Well, let me grab my skeleton man. He'll have to do, I don't know if he'll be as useful. It's so tiny to see on these webcam things. So I'll just move ahead to the vertebral column, and we'll try to get this wrapped up as quickly, as efficiently as possible, because I know I'm dragging this on. So let's get this to share screen, vertebral, share. So on the lab guide list, this is what you have in a different document. We have our cervical vertebrae, thoracic vertebrae, lumbar vertebrae. You're going to need to know there are 7 cervicals, which is different than the nerves, because remember we had 8 nerves. But if you do the thing like the trick, kind of when I was a student, was breakfast at 7, lunch at 12, dinner at 5. If you kind of think of that, that's kind of goofy. But you'll know there's 7 cervical vertebrae, 12 thoracic vertebrae. We're going to learn that each of our thoracic vertebrae matches 12 pair of ribs. So every rib attaches to a vertebrae, and that would be a thoracic vertebrae. And then we have our big giant lumbar vertebrae, and there's 5 of them. They're down here. They're going to bear a lot of weight. And then finally, we get down to the sacrum and coccyx, which are, it used to be individual vertebrae, but they fuse together. So they're just their own separate bones. So that's just the number. Then you'll see on the bottom here, we actually have the different vertebrae. So this one is a cervical. This one is a thoracic. This one is a lumbar. So each of these look different, and you're going to definitely have to name them. You're going to see a picture of them, and when we go through the features that we're about to do now, then of the feature, for instance, the body. The body of the vertebrae is just this part that the weight will actually be bearing on. So I'm drawing as a giant circle. So you can see the lumbar body is really big compared to the smaller cervical, because there's less weight high up on the cervical. So how you would say it, if I were to do a test question and I were to say name number 1, in this case it would be body of a thoracic vertebrae. Okay, so that's where, so you're going to get a feature of the bone. Let me get rid of this. Okay, So first of all, from here, this big summary thing from our lab list is you should know the number of vertebrae in each one. Then all of these guys will have these features. So we'll go through all the features as well as the distinguishing characteristics, how you can tell the difference between them. So here is our vertebral column. We have our cervicals up in the neck, the thoracics are attached to ribs, and our lumbars are below that. Again, here's just a list. Cervical, there's 7, 12 thoracic, 5 lumbar, then we have the sacrum and coccyx. You can see another view here with the curvature of the spine. I won't ask you any questions about the curvature, but this is just a nice picture to show you the different vertebrae and how they look. Now, just to give you a hint, all the cervical vertebrae, they have this extra hole known as a transverse foramen. So we'll get to that in a moment. But if you see a vertebrae, say you're out on a hike and you see some sort of skeletal remains of some animal and you pick up what's clearly a vertebral section, they all will have the hole in the middle where the spinal cord was. But if you have one that have these extra little side holes, then you can lift it up and tell your hiking partners, oh, looks like a cervical vertebrae. And then they'll think that you're like super forensic scientist there and identify. But anyways, it just has the extra holes. When we get to the thoracic, because it attaches to ribs, they have these little weird little smooth spots on the sides where the ribs are rub up against. And so those are called costal facets. And when you see a lumbar vertebrae, it's just giant. It's got really stumpy ends and a huge body. So, and we'll go through these individually, but this is a nice summary slide of that. So of this picture, the things that I have circled in red are the ones that's from your list. So there's things that I don't have you know, the pedicle or the lamina. So I just was a way to say a generic vertebrae, let's not even worry about what type it is. Technically it's a thoracic vertebrae, but anyways, we won't worry about that. So we'll start off with the spinous process. The spinous process here is the part, I'm gonna go back here, is if you're gonna run your fingers down someone's center of their back. If you're just sort of like stand behind them and you run your fingers and you feel all the bumps around their back, that's the spinous process. The portion that wings out to the side is the transverse process, because that means it's going to the side. Then the hole in the middle, where the spinal cord is known as the vertebral foramen. And then easy, the big part that all the weight sits on, is known as the body. So the hardest part, I'm just gonna skip it, is the articular processes. So they're confusing and hard enough to show you in class. We'll just skip it. I'll tell you about it, but I won't test you on it when I get the individual vertebrae out. So we're gonna focus on the blue guys here. These are features on all vertebrae. So we would have the body, let me move, sorry, the videos are at the bottom in this case. So the body, I'm gonna put as a B on each of these. The spinous process, I'm gonna put an S. That's the spinous process. The transverse process, it's easy on this one. I'm going to put a T. The cervicals, it's a little harder. It's just sort of this side shoulder bump. So it's a T. I'll put a T here. Okay. And then the vertebral canal, also known as the vertebral foramen, so it's either one, is actually this guy in the middle. Just put a big V. Obviously, that's the hole here in the middle. So those are the main things that you're going to need to look for. But now we have to figure out which one they are. Which one is the cervical, thoracic, no, this here's for the cervical, thoracic, or lumbar. Even though I'm not going to test you on it, I'm still going to show it to you just because I feel like a bad teacher if I didn't. These guys here, superior articular process and inferior articular process, when you hook a vertebrae together, you literally have one of the vertebrae up here, the upper one, and then a lower one. The one down below has a flat surface that sticks up, and the one above it has another flat surface, and they meet in the middle. And I'm going to stop share. Discard. Let me go back to here. Sorry. Let me grab a vertebrae. So in this vertebrae, you can see here we have, this is a lumbar. So we have the body, we have the vertebral foramen, we have transverse processes on the side and the spinous process. So if we hold it up, see these little wings that go down below it? And then we have little wings that go up above it. They literally cup with the neighboring one above it and cup with it below it. And that's how our vertebrae are stacked up. So when we have, let me take my little, so when you have a vertebral column that's lined up, how you would get two together is they have these facets. Uh-oh, my guy's arm fell off. These little, I always think on some of them, they look like Mickey Mouse ears that stick up. So they stick up on one side, but then the lower here on the one adjacent to it would cup to it. So they're really hard to see, so which is why I'm going to skip them for your test. Normally, we do this type of test in the classroom with a clipboard, and you're going around the classroom, and I have all these bones laying everywhere with stickers on these parts. And then you have a blank clipboard that you just have to write everything out from scratch, like anyways, on the vertebrae or whatnot. So this is showing us the 3 parts of a cervical vertebrae. Well, there's cervical vertebrae, this is like a normal one, and we have these weird number 1 and number 2 specialized ones. So of cervical vertebrae, cervical, we have 7 of them. But number 1 is known as the atlas. So where did I put that? Oh, I deleted it. I had the sculpture. The atlas is known as the god that's holding the world on his shoulder. So that's why it's named for that, because the atlas is the first one that is the top of the vertebral column that your skull, those occipital condyles, are going to rest on. So your atlas actually has these little cups right here that I like to say as yes. So they help rotate your skull up, forward, and down. So it's saying yes. So that's C1. Where the axis actually has this weird little protuberance. It's like this thing that sticks straight up. And that actually goes up and pivots. And so that would be your no. So you're actually pivoting right and left on your axis. And that's C2. So those are just specialized ones. The main ones for the cervical vertebrae that you will see that I would put on a test would be this lower one, that you're able to see the body, you're able to see the vertebral foramen, you got the spinous process, you have the transverse process. Well, I'm showing you as a shoulder. This one shows a transverse way down here. I'm just saying anything over here on the side, you can name it transverse process. The special feature that oddly enough, some cervical vertebrae have this cleft in their spinous process. That's another way to point it out, but I don't really care about that, is this guy here, transverse foramen. That's the little extra holes that you see. Let me roll. There's blood vessels that actually go through there, the ones that are going up to your head, to your brain. So those transverse foramen is unique only to a cervical vertebrae. This here is C1 and this guy is C2. So you can see these cups for yes, and you can see C2. This is a thing that pivots right or left as it for no, side to side. You kind of rotate that way. This here is a normal vertebrae. You have the bifid spinous process. You have the transverse foramen. This here is it stacked up, cervical vertebrae. And one of the things I really liked, oh, I didn't show you. I deleted it, sorry. My favorite thing was like literally one of my goals in my life was to see a giraffe skeleton. because they have the same number of cervical vertebrae that we do. And so I was like, I have got to see that skeleton. And so then I've subsequently been able to see some obviously on the internet. But when we were in London over spring break and we went to the Natural History Museum, when you first walk in, bam, there's this giant skeleton of a giraffe. So I got loads of pictures, but then I'm a really apparently terrible photographer. So they turned out really bad. And so the only picture that turned out really good was my son who was using my cell phone. So I have this fancy smancy camera that have really bad pictures of it. So I have yet to upload them, but I just thought that was a fun fact for you guys. We have 7 cervical vertebrae and so does a giraffe. Theirs just looks really cool. And they're just bigger. Okay. So thoracic vertebrae, we'll get into that next part. The specialized feature, costal, the word costal means ribs or rib, I guess I should say. And the costal facet is a smooth part here on your transverse process because the ribs are going to stick out. So you can actually see, here's a costal facet, here's a costal facet, here it is too. And so literally it would be right here. So the ribs actually look like, this is a rib, obviously, but the rib has this weird heel. It's almost like a foot. There's like a funky foot. So if we say, here's the rib, here's the heel, and then here's like the toes, where the heel part is on the costal facet itself. It sort of braces against it. So that's how you know when you see, and there for sure is a test question if I do the multiple choice tests that say, you know, which of the following is a unique feature to the thoracic vertebrae? And the answer is costal facet. Or a question could be, which type of vertebrae are costal facets found? And the answer would be thoracic vertebrae. Okay, so this is how it articulates. The last thing, the lumbar, the only thing that's important to that is it's big, large body, and it's got stumpy, these guys are all stumpy. So they're pretty easy to see that way. So this is what it looks like here. You still have the basic features. This is what it looks like kind of stacked up. We have our thoracics attached to ribs and we have our lumbars below that. We go down to the sacrum. The sacrum looks like just a shovel. So I have a sacrum in here. I'll do the stop share. You can see the sacrum. So in this case, I have a sacrum. This is a female's sacrum because this sacrum is really flat and shallow. Let's see if I have a male in here. Yeah, okay. So this guy is a male sacrum, and this one, let me turn it this way, I don't want to drop them. So I don't know if you can see, so here's a 2 sacrum, I'll pull it back here. From the side view, see how, let me see, well, this guy here that I'm shaking is more curved. And this one here is flatter surface. So if you're a baby inside a female, you don't want your eye to get poked out by this because then the coccyx sticks off after that. So male sacrums are really more arched and curved than female sacrums. Females are flat and shallow. So this guy to the right is very much a male sacrum over here because it has a really prominent curved arch. The coccyx, all it is just the tail, and it used to be our tail. We don't have tails anymore. Okay, so let me finish this up, the vertebrae up. On our APR worksheet component, we have this as C1, this guy is C2. This here is a normal cervical vertebrae, so we're going to say C3 through C7. Transverse process is going to be here. Vertebral foramen is going to be here. We have atlas and axis. We already did those two. Let me move this here. Right transverse foramen of a cervical vertebrae. So this is me trying to like help you with terminology. So if we go right, that would be on this side here. That would be this guy here. Don't worry about the articulating process. And then the spinous process of a cervical vertebrae is this guy there. Okay. Next, we have our, this is going to be our lumbar. This is going to be our thoracic. So transverse process of a lumbar vertebrae is that guy right there. Vertebral foramen of a thoracic vertebrae is going to be this over here. Erase these guys. We'll skip that. Transverse process of a thoracic vertebrae. That whole thing. The costal facet would just be on the transverse process. It's actually just going to be the smooth surface in the front where a rib would be. That would be that. Body of a thoracic vertebrae. We'll just put a big B here. So it's helping you try to discern. The whole list I have going here is helping you jump back and forth these pictures so you can become used to saying, oh yeah, of a thoracic or of a lumbar. We'll do it. Articulating process, spinous process of a thoracic vertebrae. That's going to be up here because we're in the thoracic. Spinous of a lumbar. Let's see if there's anything below. Sacrum, and the coccyx is down below here. It looks like the coccyx looks like a rattlesnake's tail. Cervical vertebrae, you should know there's 7, 12, 5. You should be able to find them here. And we have our 12, and we have our 5 down here. We have our sacrum in this case, and the coccyx. Here we're back to the list from our lab guide. So you could go knowing the number and be able to find each of these on the vertebrae and be able to then identify them back to whether it's a cervical, lumbar, or thoracic. And then the rib cage is super fast. So of the ribs, we have 12. We have 7 true. When it's a true rib, it means it went back from the thoracic vertebrae and it comes all the way around and it's attaching directly to the sternum. So that's really bone to bone attachment. 7 of them do that directly. Then we have, there's the 7 from the back. Then we have sort of floating ribs. Let me go here. Our sort of false ribs. Go back here. We have our 3 false ribs. See, 1, 2, 3, these 3 pairs. They connect all together to the bottom, sort of via cartilage. So they're not directly connected bone to bone. So these ones are known as false ribs. And then we have these spinal. So again, not trying to dish on Easter week, but everybody, male and female, have 2 pair of floating ribs. So of the 12, 7 are true, that they're connected bone to bone. 3 are false, that they're connected indirectly. And 2 are floating, that they just wing off, but they connect to nothing in the front. The sternum is going to be the main bony structure. It's known as the breastbone. So we'll go through the parts of the sternum. The top part that looks like a tie on a businessman's suit is the manubrium. The body is the large portion. And then we have this little end xiphoid process, this little triangular portion at the very bottom that if you're doing CPR on somebody, you have to be really careful not to put the heel of your hand onto that. Otherwise, it could break off and point down and puncture the heart. So this is the layers. You should know the manubrium of the sternum, the body of the sternum, or the xiphoid process of the sternum. That's a picture of the manubrium. And on our list, we have sternum. Here's those 3 parts. You should know there's 12 ribs and it shows 7, 3, and 2. And that's pretty much it. Okay, stop sharing. And sorry, I really got you. Had to really stuck it to you today. Sorry about that. So that's all of our axial skeleton. When we come back on the next lecture, then we will do girdles. So it'll be like the clavicle and our scapula and then our upper arm. And then we'll do our lower girdle, like our pelvis, and then our legs. And then that will be our bone lectures. And then we'll tie that all together and have our quiz on just the bony structures, which is the first half of your lab practical. So we'll just separate that out. And then we can move on beyond that to talk about joints and muscles. You still will be responsible for the skeletal system at the final full exam. That's going to be more word questions. So there's still going to be some skeletal questions at the very end, but the precise ones of here's a picture and I'm pointing to this part is we're just going to get that out of the way while all of this stuff is fresh in your mind before we add additional terminology. And I will also post for you so you can have it to get prepared. Instead of you making your own cheat sheets, this time I'm just going to provide you with a word list of the features. So then I'll post that so that you can see it and kind of use that to get ready.
What day is that one, the practical?
I have it as April 20th. That's on our calendar. It's on the calendar for that. And so I'm just going to keep it as that rather than changing the date. So it's Monday, April 20th. Probably what we'll do, yeah. So we'll probably do the practical quiz first, and it doesn't take up a lot. I mean, it won't take up a huge amount of our class time. So we'll do that and then start on our lecture for joints right after that so that we can then, because then we have muscles the following, well, actually, I think we can just do the quiz. I think I have our schedule to where we just do that, but I'll know more when we get closer as far as the timing, but it's the April 20th. Okay, any other questions? So there's a question about the exam. I'm trying to honor people that were very frustrated with the timing and weren't able to finish the timing. So there was a question about having a vote on the type of exam. And so I'm trying to balance the honor people's expectation of the class to have the full class to take their test. And the timed component was frustrating for some people. So I wanted to, so we may still do the essay just to honor that, but if I, depends on some feedback, especially from the folks that were not happy about the timing part. But again, I think when we get past the bone structure identification, we can actually I can write questions that are more conducive to you explaining what you know and describing a process. But I will keep that in mind, but I got your vote there. Okay, any other questions? All right. Okay, I will see you guys later. See you next class period. And I will also, I did